On debate, Senator McPhedran.
Thank you very much, Your Honor. Honourable Senators, I rise today to speak to Bill S5, the Connected Care for Canadians Act, in cooperation with Senator Mary Jane McCallum on behalf of First Nations Health and Social Secretariat of Manitoba. This bill represents an important opportunity to improve how health information is managed in this country. But it also raises deep concerns, particularly for First Nations people in Manitoba whose data have been misused, mishandled, or simply overlooked for generations. This bill focuses on interoperability, data blocking, vendor accountability, and the modernization of health information systems. These goals are worthy. But I have learned from the First Nations Health and Social Secretariat of Manitoba that none of these goals can be met without a distinctions-based approach that respects First Nations data sovereignty and the complex realities of utilizing digital health systems in First Nations in Manitoba. Interoperability, Senators, has been a promise made many times before, one that has routinely fallen short in First Nations communities. Today, I am honored to be the conveyor of this information from the First Nations Health and Social Secretariat of Manitoba. Quote, attempts at interoperability have failed because systems were never built with First Nations ownership, First Nations connectivity, or governance in mind. Communities cannot benefit from systems they cannot access, especially when connectivity in northern and remote regions remains unreliable. End of quote. A significant advancement in this bill is the requirement for vendor accountability. Historically, vendors have operated without responsibility for ensuring their systems connect to others. This has created monopolies over First Nations health data. Monopolies that limit access, delay care, and prevent First Nations from exercising authority over their own information. Ensuring vendors are held accountable is not merely a technical matter, it is an ethical one. It must first define in Bill S5 how interoperability will take place. Operating without a standard kit or format for data creates significant risks to maliciously subvert or frustrate recipients of the data. Further, an exploratory committee that includes First Nations expert representation must be struck to determine what standard would be used between healthcare vendors. And may I suggest that this organization would make an excellent witness for committee. The bill must prescribe clear and enforceable timelines for data transfer so that information is not left in a perpetual state of transit where it becomes unusable to those who need it most. I report to Senators that the First Nations Health and Social Secretariat of Manitoba has serious concerns around data misuse, particularly by third-party vendors who have been known to sell or share First Nations health information with external bodies. This bill must be strengthened to ensure that such actions are explicitly prohibited, monitored, and penalized. Nonprofit facilities have rules and guiding principles as to how to use their patients' data. But forcing the transmission to for-profit centers could be mandating the wholesale monetization of people's healthcare data without an avenue of disclosure over what will happen once the transfer completes. For vendors that operate in different jurisdictions, this bill doesn't provide direction or stipulate if the originating jurisdiction should have priority. The risks of patient data monetization overshadowing patient care must be meaningfully mitigated. Honorable colleagues, any discussion about health data must recognize the centrality of First Nations principles of ownership, control, access, and possession, or OCAP. The First Nations Health and Social Secretariat of Manitoba reminded us that First Nations data sovereignty is not an aspiration, it is a living practice. First Nations-led data lodges are being developed across the country to ensure communities can repatriate, govern, and use their own health data. These efforts honor jurisdiction, uphold inherent rights, and improve health outcomes. In respect of OCAP and data governance principles, the First Nations Health and Social Secretariat of Manitoba prioritizes digital health software solutions, systems, and infrastructure that operate within the borders of Canada, honoring a principle that First Nations data remains in Canada, governed by Canadian legislation and protections. During COVID-19, the Health Information Research Governance Committee in Manitoba demonstrated what ethical, distinctions-based oversight looks like. They ensured rapid access to data during a crisis, but always in a way that protected First Nations governance, culture, and identity, and integrity. That same lens must be applied to Bill S-5. Another reason to call upon this organization as a witness when it reaches committee. We also heard about data challenges during emergencies, from wildfires to pandemic responses, when the lack of accessible, accurate information left communities without the ability to track who was evacuated, who was vulnerable, and who needed urgent support. This is not acceptable in a country with Canada's wealth and technological capacity. Interoperable systems must ensure that First Nations can access the real-time information required not only to save lives, but to protect people's wellness and dignity. I have been asked to highlight the need for data disaggregation. First Nations, Métis, and Inuit are not interchangeable groups, and research that homogenizes them under the label, quote, Indigenous, quote, is ethically and methodologically flawed. Oversight bodies have been clear. Research must distinguish among nations so that solutions reflect the unique needs, experiences, and rights of each nation. From a technical perspective, important progress is already underway. First Nations in Manitoba are actively integrating electronic medical records with provincial systems such as the eChart or the PHIMS. These systems rely on First Nations-owned vendors like Mistumu Information Solutions to model First Nations sovereignty in action. But even this progress is hindered by the persistent reality of poor connectivity in northern and remote regions. Cloud-based solutions cannot work without a stable internet. Many communities in Manitoba must still rely on on-premise data storage to ensure privacy, sovereignty, and continuity. As we consider Bill S-5, we must recognize that legislation built for urban bandwidth cannot be implemented in communities that barely have stable access to the internet. Honourable Senators, the voices we heard were clear. The bill must move from may to must. It must embed distinctions-based approaches, require First Nations governance participation, and ensure that First Nations data sovereignty is not an afterthought, but a foundation. At its heart, Bill S-5 is about more than technology. It is about power. It is about trust. It is about acknowledging that health data has long been used as a tool of colonial governance and ensuring that this legislation does not repeat those harms. Today, we have the opportunity to build systems where First Nations will inherit a health system that respects them, protects them, and recognizes their inherent rights. Thank you. Merci. Miigwech.